Hello everyone and welcome to 5 Minute Videos Study for the NCE. Today we are going to be covering clinical focus, and we are under subcategory AP, which is child abuse related concerns. So this is a big subtopic. Child abuse can also be child neglect, or it can also be child maltreatment. Can be categorized into different categories. Those can include neglect, physical abuse, sexual abuse, and or emotional abuse. Just to give you all some statistics, around 3 million cases of child abuse and neglect are reported each year. And from those 3 million cases, about 1 million are substantiated. So they have enough evidence to say that this child is abused or neglected. Neglect is the most common form of abuse and can cause severe long term damage. Um, and poverty plays a major role, as you all can imagine, in both physical abuse and neglect. So there is a correlation with abuse and poverty. Um, it, Child neglect can include parents or caretakers not providing adequate care, and this can include basic things like shelter, food, clothing, supervision, medical care, education, or other basic necessities. Emotional abuse can include verbal attacks on the child, as well as rejections, ignoring, isolations, and or terrorizing the child. Parents or caretakers might also expose the child to harmful things like drugs, alcohol, or prostitution, gambling, or pornography. Sexual assault is any sexual contact between an adult and a child, any behavior that is intended to provide sexual stimulation for the abusing person or the child, and sexual contact by someone who is in an older developmental stage than the child. Sexual abuse can be physical, visual, verbal in nature. And then physical abuse. Physical abuse is an act that results in non accidental trauma or physical injury. This could be severe corporal punishment or punishment for no reason. The caretaker can do things like hit, shake, beat, kick, bite, burn, and throw. And it's important to remember that most helping professionals, teacher, nurses, mental health clinicians, we are mandated to report any suspected form of abuse. So that is important for you all to know, and you all to understand that CPS will do the investigation. All you have to do is make the report. There is no ramification if you're doing it on good and on suspicion or good intent. Some of the common problems, as you can imagine, for children who are victims of abuse or neglect, it can cause social, emotional, behavior, and academic as well as physical health issues throughout their life. Abused children are more likely to abuse drugs, self mutilate, and act violently than children that are not abused. They also demonstrate learning and language delays. The brain of an abused child can, in some cases, be 20% smaller than a child that has not gone through abuse. And then the uh, other thing to keep in mind is that children who suffer abuse, they can or they're often diagnosed with oppositional defiant disorders, ODD, or conduct disorders, post traumatic stress disorders, and depression and anxiety. So, for a lot of these children, um, therapy is an effective form of dealing with some of the diagnosis and some of the treatments, that behaviors that are seen in the children. So that's just a little bit about some things that you should keep in mind when we're talking about child abuse and or neglect.